Hello. My speech is called Psychedelic Therapy, the Evolution of Mental Health Treatment. We've built entire fields of study to understand why we suffer and the best way to heal. What if healing the mind requires us to alter and open it first? What if the key to overcoming trauma, fear, anxiety, and addiction lies in changing the way that we see reality itself? Once silenced by politics and fear, psychedelics have reemerged as a cornerstone of modern mental health research. By exploring their controversial history and prohibition, the groundbreaking science behind their therapeutic effects, and the ethical dilemmas surrounding their return, we can better understand how these substances might revolutionize the future of mental health care. I've combed through first-hand accounts, historical data, case studies, expert analysis, and peer-reviewed research, which qualifies me to speak on this today. Come take a trip with me through the history, stigma, modern research, the future of psychedelics, and discover the profound ethical and societal implications that mold the evolution of mental health treatment. From promise to prohibition, throughout history, the human mind has been a mystery and a battleground. For decades, the idea of using psychedelics in therapy was unimaginable, a relic of counterculture, a symbol of chaos and rebellion. Yet the story of psychedelic therapy is not about escape. It's about rediscovery. It's about how science, after 50 years of silence, is finally listening to what these substances have been trying to show us all along. That the mind has the power to heal itself if we learn how to guide it. Today, the same compounds once outlawed by governments and vilified by the media, LSD, psilocybin, and MDMA, are being used to treat the very conditions that modern medicine have struggled to cure: depression, anxiety, trauma, and addiction. The history of psychedelics began in 1943 when Swiss chemist Albert Hofmann accidentally absorbed LSD through his fingertips. He was enthralled with what he described as a kaleidoscope of colors and sensations, a moment that forever changed the trajectory of psychiatry. Subsequently, in the 1950s to 1960s, psychiatrists and researchers explored LSD, psilocybin, and other hallucinogens as therapeutic tools as a potential treatment for refractory depression, trauma, end-of-life anxiety, as well as alcohol and drug dependence treatment. Early results were groundbreaking. The case study suggested that when a controlled environment is combined with psychotherapy, psychedelics could produce rapid and lasting psychological benefits. Some researchers reported unprecedented improvements in people who had treatment-resistant conditions. In fact, more than 1,000 studies were conducted involving over 40,000 patients, many of whom experienced long-term relief after only a few guided sessions. But as the 1960s counterculture and rebellion movement took hold, the same drugs used in research found their way into music festivals, protests, and college campuses. Public perception then shifted from medicine to menace. When Timothy Leary famously urged the public to turn on, tune in, and drop out, it mongered fear and panic among lawmakers and citizens. In 1970, the Controlled Substance Act classified LSD, psilocybin, and MDMA as Schedule I drugs, the most restricted category, defined as having no accepted medical use and a high potential for abuse. This single act silenced decades of research. For nearly 40 years, scientists couldn't legally study these compounds, and their potential for healing was completely forgotten. It wasn't until early 2000s that researchers at Johns Hopkins University, Imperial College London, and MAPS, the Multidisciplinary Association for Psychedelic Studies, began reopening the door to this once forbidden field. The world was about to rediscover what it had buried. The return of psychedelic research has produced some of the most remarkable findings in modern mental health science. At Johns Hopkins University, researchers conducted trials using psilocybin to treat depression and anxiety in patients with terminal illnesses. Many reported profound peace, acceptance, and clarity after just one session. Brain imaging revealed that psilocybin temporarily disrupts the brain default mode network responsible for repetitive negative thought patterns. It's as if the brain resets itself, quieting the inner critic and reconnecting the person to meaning and emotion. One participant described it as 10 years of therapy in one afternoon. Another said that she no longer feared death, but instead felt an overwhelming sense of gratitude for just being alive. For those living with trauma, especially veterans and abuse survivors, MDMA-assisted therapy has become a beacon of hope. In MAPS clinical trials, participants undergo several preparatory therapy sessions before receiving MDMA in a controlled environment. Under its effects, fear subsides, empathy increases, and patients can finally revisit traumatic memories without being consumed by them. In these studies, more than 70% of participants no longer met the diagnostic criteria for PTSD after only 3 MDMA-assisted sessions. These findings have been replicated globally in countries like Switzerland, Israel, and the Netherlands, and are now under FDA review for legal therapeutic approval. Sarah, a veteran who had lived with severe PTSD for over a decade, she had tried every conventional treatment, antidepressants, talk therapy, even hospitalization, with very little success. During MDMA-assisted therapy, for the first time, she was able to speak about the event that haunted her without breaking down. She described it later as not erasing the memory, but removing its power over her. Today, she helps other veterans prepare for their own sessions, describing her healing as the moment the war finally ended. Addiction research has also yielded very powerful results. In psilocybin-assisted therapy for smoking cessation, 80% of participants remained abstinent 6 months later, far higher than any other traditional method. Similar trials on alcohol and opioid use disorder show that psychedelics help patients confront the root cause of addiction, shame, trauma, and disconnection, rather than simply treating physical symptoms. With so much promise comes great responsibility. Psychedelic therapy is not a quick fix. It's a profound experience that requires professional guidance, ethical regulation, and psychological integration. As states like Oregon and Colorado begin legalizing psilocybin for supervised use, experts warn of the risks of possible commercialization, cultural appropriation, and unregulated use. Psychedelic therapy's roots trace back to indigenous traditions in South America and Africa, where plant medicines like ayahuasca and iboga have been used for centuries. Respecting those traditions and the wisdom behind them is essential as Western medicine adopts these tools. Legally, these substances remain federally restricted, but momentum is shifting. Major universities, nonprofits, and governments are now investing millions into research, training therapists, and setting ethical standards. The future of psychedelic therapy depends on balancing innovation with integrity, ensuring that healing remains the focus and it's not for profit or popularity. In conclusion, the evolution of psychedelic therapy is the story of rediscovery. A reminder that sometimes progress begins by revisiting what we once feared. These substances don't just alter consciousness, they reveal what's possible within it. From veterans reclaiming peace to patients finding hope after years of despair, psychedelic therapy is rewriting what it means to heal. What was once labeled as dangerous is now being recognized for what it truly is: a bridge between science and the soul, a chance to reunite psychology with meaning. As researchers continue to unlock the potential of these compounds, one truth remains clear. The mind's ability to heal itself has always been there. We're only now just beginning to listen. Thank you so much for taking the time to listen to my speech. For my visual aids, I added in some scientific research, the actual tests that were done, as well as some graphs and more information about the research that was conducted. Thank you.